Assalamu alaikum, everybody. It's my pleasure to introduce my dear colleague, Dr. Ray Joraidini. Dr. Ray is our reference when it comes to migration and human rights. But more importantly, he is the reference for many, many institutions here in Qatar, the region, and internationally speaking, also in many institutions affiliated with the United Nations. So he was the best candidate to speak with us about the vaccination ethics when it comes to migration and human rights. Okay, Dr. Ray, the floor is yours, please.
Thank you very much for those kind words, Dr. Ali. I'd like to begin by just sort of saying that this is a very different presentation from the others that you've been listening and watching in the summer school. It's more schematic and using really an applied category of migration or migrants and their how they are affected and how they behave in relation to the COVID vaccine. There is not a lot of work that has been done. Much more research and scholarly work needs to be done on this area, and hopefully will be in the near future. Now I have to find a way to move this. Yeah. So I want to begin with the quote from the International Organization of Migration Director General Antonio Vitorino, who said, "It is the responsibility of governments to guarantee that all who are present in their territory, whether nationals or non-nationals, migrants irrespective of their legal status, have access to vaccines. In practical terms, the pandemic has shown us that nobody is safe until everyone is safe." That's a nice quote, I think, to start with, because it leads into the idea that all human beings have rights, regardless of their circumstances and citizen, whether it's citizen or non-citizen, wherever they are domiciled. For migrants, the vaccination history in this pandemic is generally uneven, but it is becoming understood by both countries of origin and countries of destination of migrants that the vaccination of the migrant workforce is essential. As Dr. Ali mentioned before, migrants move internationally, and so they also risk transnational infection and distribution. And so we need to look at migrants as a special category in relation to the pandemic. The migrant labor rights conventions are the following. Principally, the main, what's generally referred to as the Migrant Workers Convention, is the International UN Convention on the Protection of the Rights of All Migrant Workers and Members of Their Families. This convention first was passed by the UN General Assembly in 1990, but did not come into force until 13 years later in 2003. And only now, some 30 years later, it's still only ratified by 54 states around the world. One of the reasons, well, for a number of reasons, but a couple of reasons for this is that this convention is so comprehensive with regard to the rights not only of migrant workers in countries of destination, but also it covers the rights of irregular or undocumented workers who may be in a country, that they also have rights that must be abided by. And it also talks about countries and country governments treating migrant workers as the same as their own citizens. Now, these provisions for this level of protection of migrant workers was not considered to be something that the countries who receive migrants, large numbers of migrants, would want to commit themselves to. So the states that have ratified this convention are largely migrant sending states rather than migrant receiving states. The International Labour Organization, again, which is also a UN organization, has two specific instruments on migrant workers. There are other conventions that do cover migrant workers, but these are specifically the Migration for Employment Convention and the Migrant Workers Convention, which is a supplementary provisions from 1975. I'm not going to go into these, but these are conventions that detail the rights of migrant workers in their countries, in the countries where they live and work. Now, migrants have worked at the front line in every aspect in addressing the COVID-19 crisis. And given that migrants make up a large share of the healthcare labour force in many countries, if not most countries, the migrant frontline health workers may already have received prioritised access to vaccines. So in that sense, we're not targeted as migrant workers, but as frontline healthcare workers. By contrast, access to COVID remains uncertain for many migrant farm workers and meat packing workers. Where migrants are working in remote areas, their access to the vaccine is usually, at the moment, is pretty low. And there are calls to prioritize vaccinations for migrant workers in frontline industries that include farm workers. Okay. The question that has been raised a number of times yesterday and today is the issue of mandatory or voluntary vaccination. I would argue that it's unlikely that governments will mandate vaccination at the governmental level, as has already been suggested by others, allowing for voluntary choice, but as also has been discussed, ensuring informed choice. And I think, Dr. Al-Awad beautifully explained what QATAR has been doing in this sense, that informed awareness raising and clear articulation of the science of the vaccination is important. And note that discrimination with vaccination, or what's called vaccination passports, will be legally permitted because of the emergency powers given to governments with a public health crisis such as the pandemic. So the discussions about who will receive a vaccination passport and the privileges that accrue to those who have been vaccinated is not going to be a legal issue of discrimination, although this is being discussed and it hasn't been well developed yet. For example, governments can force people to remain in the country. They can force them to stay at home, to avoid friends and family, to wear masks, all under the threat of heavy penalties. And this has been occurring in many countries around the world, including Qatar. However, we also know that migrant workers are mandated by the vaccine entry requirements of the country of destination. So here is where there are examples of people and migrant workers, which is my interest here, being forced to vaccinate if they want to be able to enter the country that they are going to work. So it's going to be less and less likely that migrant workers will be accepted without approved vaccination, even if quarantining is an option today. Now, there's been some work that is targeting specifically migrant construction workers as a particularly vulnerable category of migrant workers, and particularly because of mega sporting events where large construction programs have to be done. And the two examples that were given in this article published in the British Medical Journal very recently, using the Japanese Olympic Games that has just been completed and the QATAR World Cup that is going to be conducted in November in 2022. Here is the intensive building of new stadiums, but also of infrastructure, of roads. We've been watching this occur in Qatar for many years now, since the 2010 allocation of the World Cup to Qatar. Not only roadways, but railways, public transportation, hotels, and so on and so forth. And this building relies on construction workers who come from low and middle income countries. And this is certainly the case for Qatar and was also the case in Japan. And a meta-analysis coming from this article, which is cited at the bottom of the page, found that 47% of labour migrants globally experience occupational morbidity, that is disease and physical problems, and 22% workplace injury or incident. And with short deadlines, they work irregular and long hours and during hot seasons, and they live in sometimes substandard and crowded housing. These are conditions that are conducive to the spread of the virus, of course. And emerging evidence suggests that migrant populations, including labour migrants in high-income countries, may have been disproportionately represented in COVID-19 positive cases, admissions to hospital, and indeed death. Now, labour migrants in many countries were largely excluded from the national COVID-19 responses. That certainly wasn't the case in Qatar, because Qatar is very much what we might call a migrant majority country. But Singapore, with the example of Singapore with 300,000 low-skilled, mostly Bangladeshi and Indian labour migrants, and mainly in the construction and manufacturing industry sectors, found that 96% of all the cases of COVID in Singapore were with migrants living in dormitories. And according to the study, I'm quoting, the building projects for the stadiums for the FIFA World Cup in Qatar were considered critical, and the sector was exempted from lockdown and movement restrictions throughout the pandemic. That is, they continued working, as also did health and medical facilities and personnel, for food production, distribution, energy, and so on and so forth. And the emerging data from some high-income countries show a very low uptake of the vaccine in migrants specifically, not in Qatar, suggesting tailored and targeted strategies may be needed to ensure access to the vaccines and to reduce barriers to the health and vaccination systems, and to tackle issues such as vaccine hesitancy and misinformation. Hesitancy and misinformation has been covered extensively in previous presentations, although we will revisit that in a little while. Here, just to give you some visuals of the dormitory type accommodation, this is what's now referred to as Asian city is a worker accommodation site in the Wakra area that holds up to 80,000 migrant workers. There's a photograph of one of the corridors within the accommodation. This is another accommodation site here showing you just how close workers actually work and live together. This is one room, a worker's room with 4 beds. There are other examples where there are more than 4 beds, but here this is a regulation size room where only 4 beds generally are allowed under the standards for migrant worker accommodation in Qatar. So this is compliant to those standards. But that's just to give you an idea of the intense closeness of accommodation for migrant workers. This is a photograph of a queue in Nepal of workers who are lining up to get vaccine certificates in order to be able to travel to the jobs that they have contracted for in various destination countries. And it's pretty shocking. I mean, the Kathmandu Post published a small video of this. Here is, I've included this because these are hundreds of young migrant workers lining up sometimes for days for this government verification of their vaccination, which is required, it's mandatory by the countries that they are going to. I included also because one of the interviewees in the video was very, very angry at having to wait so long, and some of them simply not getting the verification certificate. And he argued that the government should give priority to the nationals who are going abroad for work because the country relies so heavily on migrant remittances. Indeed, Nepal has one of the highest proportions of remittances, that is the money that is sent home by Nepal migrant workers abroad, that they send home every month, that constitutes about 28% of their gross domestic product. So it's very, very significant. But you'll see that they are lined up with no social distancing. Yes, they're masked, but that in itself, as another interviewee in the video pointed out, is a health risk in itself. And so there's no coordination between the verification of these vaccine cards and the scheduled flights. Some of them were saying they're going to miss their flight and they're going to lose the money that they paid for their airline tickets, around $600. So, you know, here is an economic imperative with regard to the vaccines that are essential for these poor workers who are reliant on going abroad for jobs and supporting their families back home. And indeed, Nepal is suffering because in the last fiscal year, the number of outbound migrant workers fell by 55% from the previous year. Although it was already some decline in the previous year. But what this is meaning, and as many countries around the world and the economies have contracted because of the lockdowns and economic stagnation because of the COVID pandemic, has now increased the competition for jobs and competition between prospective migrant workers and the jobs, the limited jobs that are abroad for them to go to. In Pakistan, here, as Dr. Ghali mentioned earlier, thousands of Pakistanis have been banned entry into Saudi Arabia and the UAE. And that is because most Pakistanis are vaccinated by the Chinese vaccine Sinovac. And because, I'm assuming, because that vaccine contained the pork gelatin that was considered to be haram for Muslims. But I think Dr. Ghali beautifully and comprehensively explained how that can be and has been accepted as not being haram in all of those scientific developments. And the UAE, as he also, I think, mentioned, has authorized the Sinopharm vaccine, another Chinese vaccine, but not from the Sinovac. The Saudi Arabia only accepts Pfizer, AstraZeneca, Moderna, Johnson & Johnson, but still excludes the 5 vaccines produced in China. Now, we don't know to what extent these banning or exclusion policies are political, or whether they are based upon scientific or based upon serious religious concerns. It's never clear. We see in the media that these actions are taken, but we do not always get a clear, rationalized explanations. So without the approved vaccine, Pakistanis and others either lose their jobs, or they have to undergo a 10-day quarantine or 14-day quarantine at their own expense in the country of destination. And that's not affordable to most of these workers. We don't know, it may well be that some employers may pay for the quarantine required, but there's no data on that. The Pakistan government subsequently allowed AstraZeneca to anyone over 18 years that was previously only given to those over 40 years of age, in order to facilitate these work permit holders, but only if they could provide proof that they had a work permit. So these are the machinations that are going on a daily basis in relation to the provisions and the facilitation of migrant workers to be able to take up their positions in countries of destination. In Europe, the EU digital COVID certificate allows those people who are fully vaccinated to travel throughout Europe without testing or quarantines. And the European Medicines Agency approved vaccines made by Pfizer, Moderna, Johnson & Johnson, and the AstraZeneca, but only the University of Oxford doses that are manufactured in Europe. However, it has not approved the AstraZeneca vaccine made by Covishield at the Serum Institute in India, and that has been mentioned before. Now, the idea, some have made some reference to vaccine status bigotry, that is, this idea of the privileges that vaccine passports will be given, and increasingly privileged, to allow people to travel, go to restaurants, attend concerts, attend sporting events, and so on and so forth. It's still not clearly worked out, but what we're also seeing is that serious checking of vaccine certificates is being undertaken because of the discovery of fake vaccine certificates. Along with birth certificates, driver's licenses, and passports, fake COVID vaccine certificates are already on the black market. And indeed, you can, if you have a vaccine that is from Sinovac, the Chinese vaccine, and you need a Pfizer vaccine or a Sputnik 5 or 4V vaccine from Russia, you can have your certificate altered by these counterfeiters and in Mexico they cost about between $55 and $100. So these are creating some trepidation and concern. Indeed, also employers need to make decisions and are making decisions. This catchphrase of no jab, no job policy, that is, if you do not have a vaccine, then you cannot work for an employer. Applying to employers of migrant workers and others, this is a concern over who decides that employees should be vaccinated. Is it the role of an employer to ask an employee to undergo a medical treatment that they're not willing to do? Will it mean that other employees are compromised if somebody refuses to be vaccinated? And do the ethics of the common good apply here? Maslaha. What if the employer does not want to lose that employee? It might be a critical employee, but they are simply refusing to be vaccinated. Do employers risk charges of unfair dismissal if they decide that this worker or employee should go for the good of the enterprise as a whole? Or will there be discrimination charges against the employer? I mean, it is one thing for governments to have that power in health emergencies, but do employers have that right? And these are, again, issues that are still being discussed and reflected upon. Non-citizens, all non-citizens must be targeted for vaccination because they may not have official residence registration. They can't be targeted. This includes asylum seekers and refugees, as well as what is classified as undocumented migrant workers. I mean, asylum seekers in Germany and in other European countries also were put in second in line for vaccination only after healthcare workers and people over 80, and particularly lone children who were or unaccompanied minors who were asylum seekers or refugees. And the first refugees to be vaccinated were Iraqi refugees in Jordan, which was undertaken with the help of the UN Refugee Agency, the UNHCR. These are categories of people that have to be targeted specifically in order to have them vaccinated. And undocumented migrant workers, defined in the Gulf context by Philip Farg, is the following. They are people who have entered a country without obtaining an official visa. They could have been smuggled in by land or sea, or even by air, indeed. Having entered Saudi Arabia in particular legally with the Umrah or Hajj visas, but they overstayed. There are many of those in Saudi. Or having entered legally with a work permit visa, but they left their employers without their consent or the government's consent, or were born in the country to undocumented parents who may have been there for many, many years. I should say that there are people who refer to what I might refer to as undocumented or irregular migrant workers. Some refer to them as illegal migrant workers because their presence, their residence is essentially illegal because they're not authorized. But the term illegal has been basically banned in the migration and human rights literature because of a campaign that nobody is illegal. Now, there have been amnesties, and amnesties are ways in which to bring into the government purview those who are undocumented and unregistered. Just to give you some examples, in Oman, in December 2020 to June 2021, an amnesty was provided for undocumented workers to return home without any legal or financial consequences, and they were not banned for future re-entry into the country. In Kuwait also, in April 2020, 23,500 undocumented workers volunteered, but there was a report that they were placed in four remote detention camps just outside of Kuwait City before their repatriation under very difficult conditions and very crowded and unsanitary conditions. In Bahrain, between April and December 2020, the amnesty, mainly Bangladeshis, 55,000, were regularized their residency, found new employers, and remained in the country. This was largely through the Bahraini Labour Market Regulatory Authority that is in a good position to manage those in the country. The UAE has promised an amnesty in July 21. They made a promise that there will be an amnesty soon to encourage the departure of undocumented workers without prosecution, but their reason was to restore social and labor order. Saudi Arabia, interestingly, in 2020, gave an amnesty, but that was indeed specifically a health amnesty for COVID testing and treatment. And that was the only amnesty that was explicitly designed to bring in undocumented workers and residents in relation to the COVID pandemic. The limitations of amnesties are that many undocumented workers simply don't take advantage or don't accept the amnesties that are offered to them. There was a study done in the UK. Some fear being charged if they approach the government or security authorities and face immigration checks if they request a vaccine. And some prefer, in order to get a vaccine, they have said that they would prefer a safe place with convenient access, such as primary healthcare services, walk-in centres, sorry about the spelling there, and other trusted places. This is a very tenuous situation for such people who are afraid of governments to come forward. In a study by a colleague, Fahad Al-Sharif, in Saudi Arabia, he argued that many undocumented migrants may not indeed see their irregular status as being disastrous, and they prefer to remain illegally in the country, despite their possible arrest or jail term and deportation. Staying in the host country is imperative for their family survival, and they don't want to risk anything by taking the amnesty, and that might force them to leave the country. So, according to Froilan Mallet, in his study of undocumented workers in the United Arab Emirates, migrant workers often use what he calls strategic illegality approach, preferring to remain in an irregular status to avoid administrative or immigration registration and indeed costs. So, and many undocumented migrants expressed fears to report themselves, even various types of medical illnesses. So even if they have severe illnesses, they won't come forward. They may not even go to an official hospital, but prefer to treat themselves or do it in some other be treated in some other way that does not attract the attention of the authorities. So indeed, the propensity for some irregular workers to earn higher incomes because they are in the informal Gulf labour market outweighs the benefits of the amnesties. So conclusion is that states basically cannot totally eradicate undocumented labour, and thus those who remain unregulated remain vulnerable to infection and to transmission, particularly if they're not vaccinated. It's a really grey black area. I have a question mark over QATAR because I wasn't sure whether I would give you some stuff on QATAR because of Dr. El Awad's presentation, but there are some things that I can present that he did not cover. So if you'll allow me, I'm not sure how much time I have left. Oh yes, I've got a few minutes. So this study through Hamad Hospital in 2020 on vaccine hesitancy. I wanted to, this was mentioned by Dr. El Awad, but I wanted to elaborate a little bit on this. It was an online survey of some 7,821 adults, and the results showed that 20%, as I've rounded it up, I think it was actually 19.8% or something like that, but I've rounded it to around 20%, said that they would not take the vaccine at all. 20% said they were unsure, which was the hesitancy category. Now, what was interesting in the report of the study was that they concluded that there was a 20% unsurety, a 20% hesitancy in the results. But that did not make sense to me because there was 20% also who said that they would not take the vaccine. Now, maybe that's not considered to be hesitant, but rather a final decision. I'm not really sure about that. There are some aspects of this study that I wasn't, that have certain questions. They argued that citizens and females of QATAR were more likely to be hesitant than others, and that their main concerns were safety and long-term side effects of the vaccine. And also they noted that when asked how they would gain more confidence in accepting the vaccine, they said that their own research would be the best. In other words, they were not confident about using the evidence or arguments that they would read or be told by others, which is interesting. 16.7% of non-nationals said that they would refuse the vaccine, while 42.6% of nationals said that they would refuse the vaccine. Now, this is interesting because this is not really supported. Those results are not really supported by the latest vaccination data that I'm going to show you in a moment. And indeed, because it was an online survey, it was people who chose themselves, what we call self-selected sample. And so it was really not a representative sample of the QATAR population. And why is that? Because I noted that 77% of the sample of people who filled out the questionnaire had attended university, and 41% of the sample were female. Now that doesn't reflect the actual population, where around 90% are non-nationals. Although the nationals versus non-nationals was about right in the sample. So it was not a representative sample that we can really, I think, rely upon with regard to the hesitancy issue. Now, QATAR has been talked about as one of the highest infection rates per head of population, but indeed also one of the lowest, if not the lowest, death rates. One of the lowest death rates. In July 2021, there had been 227,000 COVID cases, 601 deaths, and 223,376 recoveries. So what it shows, I think, is that there is a very high recovery rate for those who contracted a positive test. Now, of the population of around 2.7 million, I think officially online population estimations says something like 2.9 million, but I've adjusted it to 2.7 because I know that in the last year or more, there have been many people have left. So there's been a reduction. So far, the latest figures are that 2.013 million residents have had at least one dose of vaccine, and 1.695 with 2 doses. In total, 3.7 odd million doses in total have been given. 81% of those over 16 years have had at least one dose. 68.6% of those over 16 years of age have had 2 doses. 96.2% of over 40s have had at least one dose, and 86.3% of those over 40 have had 2 doses. 98.6% of those over 60 years of age have had at least one dose, and 93.5% of those 60 and over have had 2 doses. Now, this compares with the world population where only 29.9% have had at least one dose, 15.4% with 2 doses, and only 1.1%, I think that was mentioned before, of low-income countries have had at least one dose. Those low-income countries include Bangladesh, Egypt, Angola, Ghana, Iraq, Kenya, Afghanistan, Sudan, Mozambique, and Nigeria. And I think this is my final slide. Entry restrictions to Qatar have been lifted for those who are vaccinated and have had 14 or more days after the second vaccination. Otherwise, they require hotel quarantine for 10 days. And because of the COVID Delta variant detected in Southeast Asia and elsewhere, many countries in fact, vaccinated travellers from the six Asian countries, Bangladesh, India, Nepal, Pakistan, Sri Lanka, and the Philippines, must hotel quarantine for 2 days upon arrival to Qatar. There were many complaints about this, but that came into effect, in fact, on the 2nd of August this month. And vaccinations, it's been announced, will be required for all fans who are going to attend the Arab Cup, which is in November this year, and the World Cup in November in 2022 next year. And for this, Qatar has in fact secured 1 million vaccine doses for the 2022 World Cup. Now, you may agree or disagree about having the resources to do this, but that's the case at the moment. Well, I'm going to leave it there and see if anyone has any questions or comments to ask. Thank you very much.
Thanks a lot, Dr. Ray. Thanks a lot for this great presentation. The first question asks if they can see the previous slide.
Yes, that one.
I hope that this is the right one. Okay, if I may start, sorry?
Yes. Go ahead.
If I may start till we receive the questions with my own question. I think one of the big dilemmas for migrants when it comes to vaccination is that the situation of those who are undocumented and who have fears that if they approach the authorities, their undocumented position will be revealed, and then so they are in a dilemma. They lose their stay in the country, or they are exposed to the virus.
Yes.
What they should do. Are there any solutions presented, like some state countries would say, for instance, if you approach vaccination center, this will not be recorded, they will not ask you for papers or something like this?
Yes, you know, this is something that I think still needs to be worked out. Obviously, what would be advantageous is that an amnesty be given to all undocumented workers, specifically for vaccination, and that it's made clear that they can approach a vaccination clinic or source, be vaccinated, but no questions will be asked. But they will be given the option as to whether to register their name or not. Now, I'm not sure that governments are going to want to do that because typically, if you are going to want to control the vaccination, you want to control this disease, then you want to know who is vaccinated and who is not. So if somebody comes forward, it's going to be something that they will want to register who this person is that is getting the vaccine. But if they can take courage, I think, and say, look, we need to accept that there are these people in the country who we in fact rely on to work, but who are not documented. And we need to accept that. So what's more important and what's the higher priority is that they be vaccinated and not remain vulnerable and out of sight. So this is the trade-off, I think. But whether that will happen is another story.
Yes, because this is, I think, a dilemma not only from the side of the migrants themselves, that they have to choose between exposing themselves to the risk of leaving the country or to the risk of the virus. But I think it's also a dilemma for the modern nation state system, which is a paper-based system. You must have a paper to document anything.
Right. Oh, that's indeed the issue.
Yes, the paperwork should be done properly.
Yeah. Well, I mean, you know, people who are undocumented are basically living in what we generally call a black market, right? And that's probably where the false certificates will be sourced and provided for those kinds of people. But it's a problem because we don't want false certificates for them to get access to various places, but we want them to actually be vaccinated. I mean, what is absolutely clear is that the vaccination is essential. And that's been made.
Yeah, and it's good also for the public health of the country, because if these people remain unvaccinated, it will be difficult to reach the herd immunity thresholds.
That's right.
So you are still in problem, and these migrants are usually workers, people who are very active in society, and they move and they get in contact with people. Yes. So it seems it is a dilemma on both sides. Yes.
Right.
I also wanted to ask you about the vaccine passports. You mentioned in your presentation about that this is a kind of discrimination that has been permitted by the countries or something like this.
Yeah.
What do you think of the idea, and of course its relevance to migrant workers in particular?
Well, I think as was pointed out before, the issue of this vaccine passport is indeed being used by governments. I think the Australian government actually is a very good example here, being used in order to entice and to provoke those who are refusing to be vaccinated to actually get vaccinated, because they will be losing out on access to places, on even access to employment, and so on and so forth. So they will become social pariahs and discriminated against. And you know, people can be very nasty. You know, I'm vaccinated, you're not. You are dirty and diseased and don't come near me. You know, these things at a personal, interactive level can be very vicious indeed. And Australians are very good at doing that, I might tell you, by the way.
It's everywhere.
Yeah, it's being used in that way. Now, you might want to take a position that that's okay. It's one way of increasing the vaccination rate and enticing or bludgeoning people to get vaccinated, because they will see what they're losing by not being vaccinated. But then again, as also has been pointed out, there are those who cannot be vaccinated, and there must be some kind of mechanism or documentation to show that a person is not vaccinated, but they cannot be vaccinated on medical grounds or something else, so that they have some kind of certification that they can use to attain the same status of those who are vaccinated within the general social interactions and access to.
Yeah. But I think other concerns, but these are general concerns, not only for the migrants. The issue of when you give these passports, it creates the impression that it is safe. Things are well done because these people are vaccinated, although there is no claim even from the manufacturers of the vaccines that the efficacy is 100%, the protection. So there are people who are vaccinated, but their body makeup, physical makeup can be problematic, and they can still get the vaccination. There were some incidents about people who died after getting from the vaccine, from the virus after getting the vaccinated, still being examined. And that these people can communicate the disease and can infect others. So this whole issue of the passport is in general problematic. And the top of this, there are people who cannot get these passports because they are undocumented. Even if everything's fine, they cannot have the vaccine because of other problems, not because of health-related problems. So this all makes the idea quite, ethically speaking, I would say controversial, isn't it?
Yes, and the countries that I mentioned and other countries also, the thing is that these amnesties that have been provided that can bring out those undocumented workers who may decide, look, it's time to go home. I'm sick of living like this in an irregular status. But these amnesties were generally designed in order for them to leave the country, to rid the country of these undocumented workers, but to do it without, to give them the chance to do so without penalties, because many of them live in fear because they may, there may be fines that have accrued to them that they could just never pay to the government, and they don't want to end up in a detention center or with a criminal charge against them, and so on and so forth. So these are conditions that prevent them from coming forward, and they will wait for an amnesty.
Okay. The last thing that there is a question here. They say, can government implement a database system within healthcare that can give easy access to employers around the globe to define individuals' status in confidentiality, to create a database that will be accessible to the employers?
I'm not quite sure the reason for the question. I mean, if it's suggesting that the database so that employers can choose from that database those who are vaccinated, I don't think it doesn't usually work that way, because at least in this region, employers are using recruitment agencies, and they will simply include a provision which will be a government provision anyway, that any prospective migrant worker who is going to come to take up a position by an employer will have to be vaccinated. And so there are the vaccination certificates, then there's the attestation of those vaccination certificates by their own governments. And then for QATAR, that may well also have to be attested in the QATAR visa centers that are located in the countries of origin, and so on. So there's lots of paperwork and checks and balances in order to make sure that the workers that are being employed are vaccinated. So I don't think it needs, I mean, some governments have databases. The Bangladesh government, for example, did set up a database of prospective migrant workers, but these are pretty much redundant these days. Yeah.
Okay.
I'm not sure why it wouldn't require to be confidential. So.
And also around the globe. It's not only for within a country. It's she's speaking about around the globe.
Right. Yeah.
Maybe for exchanging the employees, yes, or something. I don't know.
Mm-hmm. No, it's an interesting question, but I don't have a clear answer.
Okay, then I thank you very much, Professor Ray, for joining us with this lecture. And inshallah, tomorrow we will meet at 6 p.m. Doha time to have this panel and to open the forum more for discussions. We will also have some new faces who will join us tomorrow, and it will be more of an interactive panel discussion and also concluding the event. So we will see you tomorrow, inshallah, at 6 p.m. Doha time. Thank you so much. Thanks, Dr. Ray, and thanks for everybody.
Thank you.
Thank you.